Hi everyone, welcome back to my YouTube channel. My name is Gayatri Velit. I'm a counseling psychologist. I have a private practice in Mumbai and I take online sessions as well. So as you must have already read the title of the video, in today's video I'm going to talk about PMDD, which is premenstrual dysphoric disorder. Very important topic that is not spoken about. Periods is such a normal phenomenon that women experience, and it's so unfortunate that this topic is not spoken about in our society. There's a lot of misinformation. There's sometimes even misdiagnosis in the medical community. Now this is something that's been recognized only recently in the psychiatric community, but let's also say this, that it has always been present and it's not a new thing that women are experiencing. So before I talk about what PMDD is, let's understand what is PMS. And you must already know what is PMS, but let's understand it and draw its connection with PMDD. Now PMS is a set of symptoms that a woman experiences in the late luteal phase, and sometimes it goes off on her second or third day of period or after her period gets over, and these set of symptoms can cause a mild to moderate amount of discomfort. Now these symptoms range anywhere from mood swings, anger, irritability, breast tenderness, muscle pain, joint pain, crying. There is also, cognitive functions that are affected like memory, concentration, overeating, undereating, oversleeping, undersleeping. So these are the symptoms that we know that women experience, and of course the food cravings. How can I forget that? The need to have that bucket of ice cream before you get your period. Now PMDD is basically all of these symptoms multiplied by 100. What I mean is the intensity of these symptoms is way too high in premenstrual dysphoric disorder. It's so high that a woman is not able to function properly. There is clinically significant distress that affects her social life, her work life, her interpersonal relationships, the relationship that she holds for herself. All of these things get significantly affected. And you will notice that a lot of women with PMDD say that, I was experiencing all of these things, and the day I got my period, all of these symptoms vanished. How can it just go like that? This is a very important feature of PMDD. And other than the symptoms that I've already mentioned, some other symptoms that are also present in PMDD is an increased sense of hopelessness. It's almost like the woman is experiencing depression before her 1 week of period. There is an increased sense of rejectivity. And most importantly, she experiences suicidal thoughts. A lot of women I know who have experienced extreme level of suicidal thoughts, and the moment they get their period, they are like, wow, why did I even get this thought at the first place? That is why I decided to talk about this today, because we need to increase awareness on PMDD. Now, what are some of the causes of PMDD? Now, there is no definite cause as such that okay, this is why PMDD happens and this is why it happens, but according to whatever research has already been done, let me tell you, there's not much research about this topic unfortunately, but whatever has been done, the first reason that they have mentioned is that if there's already history of PMDD in your family, then you're predisposed or you have an increased sensitivity to developing it. Second, we know that there is some sort of changes in hormones and neurotransmitters before you're about to get period. Now, one mechanism that I'm going to tell you is that how the hormone, which is the reproductive hormone estrogen, there's a drop in it, right? Estrogen and progesterone. Especially if you're not pregnant, there's a drop in estrogen. Now what happens when there's a drop in estrogen is that a neurotransmitter named norepinephrine is released, and when this is released, there's a drop in dopamine, acetylcholine and serotonin. Now what you have to take away from this is that a drop in serotonin, which is the happy hormone. So now you can understand that why there is such extreme sense of sadness, almost mimicking depression, while a woman is experiencing PMDD. So this is the fluctuation of hormones, the serotonergic systems of the body, especially if it's a sensitive serotonergic system, then there's a possibility of PMDD to occur. Another thing very important to mention is if the woman already has other mental health issues, so she's already having some problem, then definitely that is going to exacerbate her PMS symptoms, which is basically PMDD. Or if there's a history of trauma, or if there is already mental health issues in the family, all of this is going to add up. Like I said, it is not my job to tell you why you have this, but it is your job to go to a medical doctor, a psychiatrist, a psychologist and get it checked to know that is this something that you have? Okay, so please don't self-diagnose. Okay, Gayatri, what is the treatment of PMDD? First thing I want to tell you is that if you're experiencing extreme discomfort, I know discomfort is very subjective. You might say, what if my discomfort is not too discomforting for it to be qualified as PMDD? Pause. It's not your job to make that decision. Go to a psychiatrist or clinical psychologist and let them do their job and help you in the diagnosis. So if you're experiencing discomfort, you can always go and confirm it, right? There's nothing wrong about it. Now, treatment, first thing is lifestyle changes. You have to make changes in your diet. So firstly, I'll talk about addition, then I'll talk about elimination. So in addition, basically what healthy stuff you can add. So you can add more veggies in your diet. You can add more fruits in your diet. You can make sure that you're having a balanced diet of protein, carbohydrates and fats. You can make sure that you are having, the herbal tea, chamomile tea, something that can help you in easing the symptoms. Now when I talk about elimination of unhealthy stuff, sugar, please, it increases way too much inflammation in the body. Eliminate that sugar at least in that span when you're experiencing PMDD. Then secondly, there is caffeine, alcohol, smoking. Try to reduce or eliminate these things. I would say start with reducing, especially when you are experiencing PMDD. I know you get the urge to do it, but sometimes you have to do this for yourself and your body and your mind, right? With respect to vitamins, vitamin B6, vitamin D, magnesium, calcium, these are some supplements that you can take, but only under the supervision of a doctor, and especially if you have been prescribed this. Okay, so this is also that can help you in easing your symptoms. Sleep is very important, because when you're sleeping on time or when you're not sleeping on time, all of these things add a lot about how your hormones and neurotransmitters are being balanced. So of course, if you're not sleeping on time, then there is disbalance in your hormones and neurotransmitters. Exercise, definitely it's going to release endorphins, right? So that is something that you can add. And honestly, I know it's difficult to exercise when you are going through PMDD, but even if you take 2 minutes, trust me, even if you take 2 to 3 minutes every day to exercise, that's also enough. Other things that you can do, alternative things that you can do, is you can do some breathing techniques, grounding exercises, you can get a massage for yourself, red light therapy. A lot of these alternatives also you can do to calm your mind and your body. Now when it comes to medications, you have to go to a psychiatrist, and research has actually stated that how medications have really helped a lot of women with PMDD to ease their symptoms. And most of the times the medications that are prescribed are antidepressants, especially in the section of SSRIs, which is selective serotonin reuptake inhibitors. So what these SSRIs do is basically they increase the amount of serotonin so that you're able to feel a little happy amidst all of these extreme symptoms. Therapy, very important. PMDD, yes, you can make changes in your lifestyle, your diet, take those medications, but we all know that whatever problems that we experience in our life sometimes tend to get intensified either because of our personality, our temperament, or because of the thoughts or the perception that we have towards something. And that is exactly why I mentioned therapy is also very important. When I spoke about one of the symptoms of loss of control, so in therapy you can actually discuss about that with your therapist, and he or she can actually help you in how you can actually work on this sense of loss of control. It could be either through CBT, that is cognitive behavioral therapy, or any other form of therapy that can address this issue. So therapy is definitely important, because you will kind of develop a PMDD survival kit with your therapist, where you all can sit and make a list of things that you all can do when you're experiencing PMDD, track your thoughts that you're experiencing, some grounding exercises, relaxation techniques that you can do. So therapy is also very important. Now PMDD has always been a very controversial diagnosis in the psychiatric community, because a lot of people have different and extreme opinions about it. So if you see from the psychiatric community, the psychiatrists think that it's a very important diagnosis and it has to be recognized, and even the pharmacological industries support this diagnosis. Some of the psychologists also do, but there are also some psychologists who think we shouldn't put a label to this, and this diagnosis can only kind of increase the pathologization of symptoms that women experience before getting their period. Feminist writers also have said that PMDD could be just a label to silence women for what they're experiencing before their period, which is very normal. Now, these are the opinions that has been shared and what I have read. Now, if I were to give my opinion on this, I would say that it's a mix of all of these things. With respect to what I have observed in my practice, I have seen that PMDD, when women get that diagnosis, it has helped them because now they have something to label the extreme discomfort that they go through. Secondly, I also believe that this is not something that should be used as a weapon against women. It should not be said that because of the biological differences in a man and woman, that does not mean a woman is psychologically weaker than a man. So you cannot use this in conversations or to put a woman down. So definitely my opinion is a mix of all of these things, and ultimately it's based on the client. What is most comfortable to them is what matters to us professionals. So that's the end. If you like this video and if you felt like I could provide you with some information and insight, please don't forget to like and subscribe to my channel, and most importantly, share it with the women in your family. Even if you're a man who's watching this, share it with the women in your family so that they can get an understanding of what is it that they're going through. I hope you take care and stay safe. Bye-bye.